Good afternoon, everyone. Thank you for joining PHCA for today's webinar, Pennsylvania Health and Wellness Introduction and Contracting Orientation. I'm Wendy Johnson, Executive Assistant for the Pennsylvania Healthcare Association. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and gain better understanding of practical application tools to equip our members so they may continue to provide the highest level of quality care possible. Before I begin today's webinar, I have a few housekeeping items to cover. This webinar is being recorded and will be made available on the PHCA website by the close of business today. Today's webinar is informational and not for credit. Most of our other webinars are for member credit, but today's webinar is informational only. Melissa will be sharing important and timely information for you today. Feedback is important to us, so we'll be sending you a survey following the webinar. Please complete this survey, and if you are participating in a group setting, have each participant also complete the survey. All attendees are in listen-only mode. However, throughout the presentation, please feel free to submit questions using your question pane, and our presenter will address them at the end of the presentation. Now for today's webinar. Pennsylvania Health and Wellness will be presenting today's webinar so that you can learn more about this new managed care organization and their parent company, Centene. In addition, a 101 on contracting will be provided. Your learning objectives for today are: learn more about Pennsylvania Health and Wellness and Centene Corporation, understand more about the contracting process, and know your local team, who your local team is and how to contact them. This webinar will be presented by Melissa Seawick, Director of LTSS Network Development. Melissa, the floor is yours.
Thank you, Wendy. Hi, everybody. This is Melissa. I'm really happy to be here with all of you and share this information so that we can start building the network so that when it's time to go live, we are absolutely ready in every region. Special thank you to Wendy for helping me put all of this together, and to the Pennsylvania Healthcare Association for being such great partners and welcoming us into the community. So as Wendy said, this webinar will kind of go over Centene, Pennsylvania Health and Wellness, and then by the time you're finished, you will know what you need to do to submit your information to get a contract initiated, and what will happen after the contract initially goes in, and what do you need to do to get credentialed. So I know that's been weighing heavy on people's minds. So the first slide here is talking about what is our purpose for being here. I mean, yes, the reality is that, you know, the state decided that they wanted to kind of stick managed care right in the middle of a process that you are all very comfortable with and know, and it changes everything, and that can be a little scary. So we want to make sure that you understand that we are an organization that definitely believes in better health outcomes for people at a lower cost. I mean, throughout the country, this is what our mission is. And our brand pillars are to focus on individuals, make sure that we have active local involvement, which means we don't open up service to a community without having local facilities, local offices, and local branding, and people from the community serving the participants in the plan. And we focus on whole health. So we want to make sure that people are not just getting to their doctor, but they're getting all of the wraparound services that will make them successful in whatever environment they want to live in. So because you can download this webinar after the fact, I will let you go ahead and read through the beliefs, but pretty much they reinforce the ideas that we're all about helping people achieve their goals in their lives, especially when it comes to LTSS. We want to make sure that we have everything ready to be provided to the participant so that they can live successfully in whatever environment they choose to live in. So our company overview, like I said, Centene is our parent corporation, but in every community that we are in, we have a local presence. So right now we are teeny tiny. I think that probably we have less than 100 employees between the Camp Hill office, the Pittsburgh office, and the Philadelphia offices, which is where our three headquarters are going to be. But we need to get up to 1,600 employees. So this is a huge undertaking, and it's all going to be people from the area, from Pennsylvania. I grew up in Pennsylvania, grew up in Lancaster County. So, I am not a transplant from Centene that has moved here to help out. I'm from the company, and they brought me in. Centene Corporation is pretty big. It's a little intimidating. It's number 124 on the Fortune 500 list, although I think that it jumped quite a bit this past year. And it is one of the fastest growing companies in 2015. So if you look over to the right on this map, you will see that we are in 24 states with Medicaid and 9 states with MLTSS. So yes, we are brand new to Pennsylvania. We have not served this community before, but we have implemented and run with LTSS programs before. In some of the communities, they call it long-term care, but it's still the same concept. So if you look down at the bottom, we have 11.4 million members in 28 states and 2 international markets. Please don't ask me where the international markets are. I have no idea, but I can find out for you if you're really interested. But that's a lot of members who are receiving their health care insurance from Centene. So these are the areas in which we just have the MLTSS plans. So Florida and Texas are probably our biggest plans, but they keep on saying that Pennsylvania is going to rival those two for the largest MLTSS plan. So we have 4 kind of key components to our model. We're implementing a person-centered integrated approach. We're engaging with consumers and advocates. We're making community living a reality, and we're partnering with our provider network. And this is one of the reasons why this is so important for us to have a personal relationship with you and with associations like the PA Healthcare Association, because you guys are what's going to make it happen for participants. So when we talk about making community living a reality, we're really trying to engage with Centers for Independent Living, area agencies on aging, nursing facilities, personal care providers, service coordinators, all of those different components. And primarily we're doing that through associations. We're connecting with them first and then connecting with individual providers. So we have lots of different work groups happening to help us figure out, how's this going to look? We don't have everything figured out yet, even though we've done this in a couple of other states, and that's because each state is unique. Each state has its own rules and regulations. And in Pennsylvania, of course, everybody is painfully aware of the service coordination feature that, there needs to be 180 days of care continuum, and that's making people nervous. All right, so that's great for the first 180 days. Well, what are you going to do afterward? Yeah. That's a question that we have too, and we can only answer that if we have feedback from you. So we have asked the Pennsylvania Healthcare Association to pull together a small work group of providers to help inform us of, kind of some of those transition issues. What are things that, your providers do better than anybody else? What can your providers offer to us, and how can we also stay central to our core competencies? So all of those things need to be worked out, but know that we want to partner with you on that process. If we move on to the next slide, we want to utilize current services you provide to ensure that the patient has appropriate support. So, we want to utilize current educational and training sessions for providers and staff. We want to offer provider services to you guys to make this transition easier. This is one of those things by having this webinar. This will not be the last webinar that we ever have with you. And probably the most important well, actually, there are two things. One is that we're not here to recreate the wheel. We're not here to duplicate services or create unnecessary work for you. There's a system that's already in place, and we want to borrow as much of that as possible and overlay what we do on top of it. But for you, we want to make sure that you get accurate and timely payments. Centene has a really sophisticated claims process, and for the most part, they're getting payments out for clean claims in about 10 days. So that has been another concern that I've heard as I've gone out to talk to providers, oh my gosh, there's going to be a gap in payment. There shouldn't be a gap in payment as long as we get the contracting and credentialing process right in the beginning. You should be able to get clean claims submitted and paid in a very short amount of time. So we definitely engage with consumers and advocates. There will be a local advisory council that is developed, and there is a national advisory group that we work with. So the consumer voice is incredibly important to us as we go through this process. We don't do this in a vacuum. So we need to talk to you, we need to talk with consumers, and we need to talk with advocacy groups. So if there's anybody you feel like we're not talking with, please let me know and we'll reach out to them. We also want to implement a person-centered integrated approach. So we're definitely going to link consumers and families to medical and non-medical community resources. Service coordinators will be trained on all of the local resources that are out there in order to do the appropriate information and referral. And of course, all of the associations that already do that are going to be a huge benefit to us as well. We absolutely want to offer full benefit coverage and value-added features. So value-added is something that, we're required to do in our contract, but it's become quite evident to me as I've gone through this process that we need those value-added services if we're truly going to have a person-centered approach. Not everything is covered through, the Medicaid process. So certainly we need to have extra things in place that will give people that extra leg up that they need. I've already talked about the local boots on the ground approach. We're going to have a huge staff here in Pennsylvania in one of the 3 sites. In addition, we will be having a claims facility that's built in Altoona, but I am unsure how that plays with the PA Health and Wellness claims. I'm not positive that all of those claims will go to the Altoona site, and it's going to be a couple of years for this anyway, but we'll still have more of a presence here in Pennsylvania. We're also interested in creative and flexible styles in order to be functional. So whenever we hear about something that is innovative and new and exciting, that's something that we want to learn more about. So after the contracting process, if you've got something that you really think we should know about that you're doing that's innovative, please invite us out to your facility. We'd be happy to come and visit. For the next couple of months, we'll probably decline just because we're already behind with our contracting. But after that, probably in the fall, we'll have a little bit more wiggle room to be able to come out and visit you. So we have 2 goals for community health choices. The first phase is continuity, and the second phase is quality. So this comes up a lot, what are the measurements going to be? We'll get there. First, let's make sure that you are signed up, that you are contracted with Pennsylvania Health and Wellness, and that you are able to get paid, and that most importantly, the participants are able to get the services that they need. So, that's continuity. Whatever it is you're doing right now, we want to replicate that, and we want you to just have your billing process be different. So you'll bill us instead of DHS or going to the Promise system. Phase 2 is quality. So this will be the time when we're really talking about outcome measurements, pay for performance, kind of all of those things that come along with an MCO and monitoring the home and community-based environment. How are we going to manage all of the service coordination, and then what outcomes are going to be important as we move forward. The other thing that's going to be really important is that you have a local contact, that you have somebody that you can call and say, hey, you might not be the right person to answer this question, but can you connect me with whoever does this? So that we can just transfer you from person to person rather than saying, oh, geez, well, I don't do that and I don't know who does it. You'll have somebody that can connect you. So that will be your provider network specialist who is assigned to your area, or you can call into the call center if, that's, it's just a quick Q&A that you need information about. All right, so let's move on and talk about how do you become contracted and credentialed. So step one is that you need to provide Pennsylvania Health and Wellness with your legal provider name. You need to give us your W-9, your tax ID number, your Medicaid ID number, your NPI if you have it, and who are we sending this to? Whose name goes on the contract? That kind of, and where are we mailing it, kind of thing. That's all pretty simple information, and I load that, or me or one of my team members load that into our system, and within 48 hours you will have your Pennsylvania Health and Wellness contract in your hands so that you can review it. If you look over here on the bar here, you'll see the contract form. This is the form that you would click on to fill that out and send it in with your W-9. We'll get to where do you send it in a little bit. Please know that, yes, we are contracting with everybody, but right now our focus is the Southwest. So if you are in one of the other regions, you could submit your information, but we might, hold it for a little bit before we can put it into the system. So don't be surprised if there's a little bit of a delay. So it's 48 hours from the time we submit your contract into the system that you get it back and have it in your hands. If you are in, like, let's say your office is in Center County, but you serve Cambria, Blair, Bedford, or Somerset counties, please let us know that somehow. When you submit it into the network development email, you can send a little note that says, hey, my main office is in Center County, but I serve all of these other communities. That will let us know that we don't have you properly coded in our system and that we need to process you with the Southwest region. Okay, so I talked about what happens. We submit this to our online system. A contract comes back to the provider specialist that you're working with, and then you receive a packet back in the mail that includes your enrollment information and all of the information that you are going to need for credentialing. So in that packet is, of course, the provider letter. This is like your welcome letter that says, oh, hello, welcome to Pennsylvania Health and Wellness. Thanks for being part of us. But most importantly, it kind of gives you this quick checklist of all of the things that you're going to need to submit in order to be credentialed. Of course, you've already submitted your W-9, but you'll need things like disclosure of ownership form. If you have a state license, we're going to need to see that, Medicare or Medicaid participation certification, general liability insurance policies. If you carry malpractice or comprehensive, we'll need to see those policies. And most importantly, who you want to send this to. All of this information should go back to Lynn O'Brien and Ashley Page in Missouri. They are kind of the first step to your credentialing. They submit your signed contract into the Taurus product and then send off all of your information to the credentialing team so that you can become a PAR provider with us. You'll see down here that our fax number and our network management email is there. You can use that network management at pahealthwellness.com for general questions and to submit your contract form. And it will go to the appropriate contact who will submit your information in for a contract. You'll also receive this Pennsylvania Health and Wellness flyer, just a little bit of information about who we are and what LPSS is. And then you'll get the enrollment application. And I want to make sure that we spend some time talking about this because this enrollment application keeps on changing. And, we just want to make sure that everybody is aware of the information that you need. So this first page of the enrollment application mirrors pretty much what's on the welcome letter. The next is kind of what are all of the certifications that you have, trying to get down to whether or not you have license or certifications in certain specialties. What is your legal name? Where do we bill and where do we mail information? We have information on you in our system, but we just want to make sure that it's totally accurate because the last thing we want to do is be sending you mail or, getting your billing information wrong in the system because that will just delay things for you. So yes, you might have to provide this, you might have already provided this to the state, but certainly you need to provide it to us so that we can ensure we have accurate information. The next page focuses on your primary facility. Some organizations have one facility. Other organizations have, multiple sites. So certainly you want to give us information about every single site that you have, including those locations that are just, you don't have an office in a particular county, but you do provide service. We need to know all of that information so that if a participant is looking for you, you have a service that they need and they live in XYZ county, they want to be able to look in their participant manual and see you listed there. That's what this all boils down to. We need to get this right so that you get paid and participants can find you. So some of the other things that you're going to need to provide about your facility is service hours, whether or not you are ADA compliant, and if you are a specific type of facility, if you have certifications. Page 4 of the enrollment application is asking questions about malpractice. We know not everybody's going to have malpractice insurance, so that's okay if you leave it blank because it's not applicable. Your general liability, we're definitely going to need to know about that. And then this is where it talks about the secondary facility. This kind of mirrors the primary facility questions. Page 5, again, this is all about the secondary locations. This page is where it gets a little tricky. So on the top, on page 6, you'll see the Pennsylvania counties with a corresponding number. So Adams County is number 1, and all the way down to York County is 67. You want to list by service where you provide that county with the number. So if I am an adult daily living facility and I am in, let's start with some. If I'm in Westmoreland and Allegheny counties, and I've got 2 different facilities, you want to make sure that you are listing number 65 and number 2 under service county, so that we can appropriately track where you are providing the service. And then we want you to put your address in. You might need to add some extra pages or spaces if you've got a lot of these, like one type of facility. And then the location ID is, related to the 4-digit code that is at the end of your Promise ID. So here are some of the other services that we would need you to do the same thing for. So whatever service you provide, tell us where you provide it. That's what this is really about. Okay, page 9 is confidential information and signature pages. And then this is what you will get back. This is the kind of the first page of your contract. It is, I will not lie to you, it is not a tiny contract. It is 45 pages. And certainly you want to pay attention to the LTSS addendum that is, I think it's addendum B, that's part of it. But read the whole thing. Okay, and then you will also get this credentialing checklist. This is information that you would need to provide by service facility type. so that you know what you need to turn in. If you're a skilled nursing facility, we need your provider application back, your general and professional liability insurance, your state operational license, your accreditation by a CMS deemed agency, and other applicable licensures, and then your ownership and disclosure form. So not every organization is going to have to turn in the same material for credentialing, but we wanted to try to make this as easy as possible by giving you a credentialing checklist. Okay, let's talk a little bit about our team members. You know me, my name is Melissa. Deanna Zdinak is one of your provider network specialists. So she is from the Pittsburgh area and will be serving the entire Southwest region, along with Melinda Rios, but she has not started yet. She will begin in the middle of July. So after you get contracted, that's going to be your team who will kind of take care of doing your orientations and making sure that you have the training that you need, and would be the people that you call if you're having, you know, a pretty serious issue and you need to talk through it with somebody. They'll also be the people that you talk to about quality initiatives. We also have Chantel Ware and Angela Bumbach. These are also PA Health and Wellness staff, and they will kind of move on to the next region after we are finished contracting. But Deanna and Melinda will be your ongoing contacts afterwards. So I wanted to also mention Gerard Hubbard and Leslie Walker. These are people who are from Centene Corporation who are assigned here in Pennsylvania to help us build our network. They have a Centene email, and that's okay. We're all still part of the same family. In fact, somewhere along the line, I started off with a Centene email, and then they localized it, so now I have this, you know, ginormously long email address that will give somebody a hand cramp if they ever tried to write it down. And so I just wanted to let you know that if you get an email from somebody from a Centene Corporation, or you get a phone call from somebody that has a weird area code on their phone number, that's okay. We're all part of the same team. We're all trying to build our network, and these are some of the names that you might hear on the other end of the phone. Okay. So how do you initiate this form? There's a couple of different ways that you can do it. One, like I said earlier, you can download the contract form, which is connected here on your sidebar. You can also, you know, click directly on the PA Health and Wellness link, and it will take you to our website where you can fill out the form. The form is not completely updated yet, so you might have to provide extra information. I think your best bet is truly to go with the form that is attached to this email and email it in to the network management email address. You do not have to wait for us to reach out to you. If you want to get your contract started right now, go ahead and send in this information with your W-9. Really, that's all you need to do at this point to get your contract sent to you. You know, like I said, we don't have time right now to go out and do face-to-face meetings. We're happy to pick those up in a couple of months after we get the bulk of these contracts done. So it's perfectly okay. You don't have to have an in-person visit or a phone call in order to get your contract initiated. That's something that you can initiate on your own. So the Pennsylvania Health and Wellness website, you will see a section here that says for providers. And then these are all of the different drop-down menu items that will come up for you when you click on there. And like I said, the site, the particular page where you can request a contract, which is the Become a Provider link, is being updated to reflect the Excel worksheet that you can download. So like I said, use that. This is currently what Become a Provider looks like. You can certainly call in to the 1-800 number to be connected. You can email the information at pahealthwellness.com if you just have a question, or you can email the network management at pahealthwellness.com email address to get in touch with somebody. Okay, I think that we are ready for questions.
Thank you, Melissa, for the great information today. At this time, we're going to open it up for questions, and we already have 2 so far. So if anyone has any other questions, please use your question box on the right-hand side of your screen to submit those questions. And we'll give it just a couple seconds here. I can have Melissa start answering the questions that we have here. Let me start with the first one. The first one is, I submitted everything on June 14th to Leslie Walker. What is the turnaround time for receiving the agreements?
When it gets put into the system, you should get your contract back within 48 hours. So I will need to follow up with that. If Wendy, if you can let me know who asked the question, because you should have your contract already.
You bet. I'll take care of that. Not a problem. I'll send that to you after the webinar. And the next question is, how about the policy and different compliance that provider need to adopt from PA Health and Wellness to meet all the PA requirements?
So I guess I need a little bit more information, like what in particular are they referring to?
Okay, this one says, let's see if there's another question to this. How is the pay rate, hold on a second. How is the pay rate to the provider, and what would be the starting rate if reliable to discuss now?
Our plan is to pay you what you're getting paid now, so 100% of Medicaid. We are, not really actively negotiating contracts because, one, we're so far behind. There was quite a delay from the state in getting our material approved before we could go out to providers to actually sign the contracts. And they're still holding us to the September 1st deadline. Your contract can be renegotiated in 6 months. So, what we're asking providers to do is, sign up now, get paid 100% of the Medicaid rate, and then in 6 months, if, you want to talk about negotiation, then we're happy to do that.
Okay, this one may go back to the earlier one. Did the provider need to adopt new policy in regard to OLTL? So Office of
right. Yeah, I guess I'm not sure exactly what provider type you're talking to or talking about, or is there a particular policy that you've heard you need to adopt? Is it related to credentialing or staff education requirements?
Okay, let me grab some of these other ones. All right, let's take another one here. Will ancillary companies need to be credentialed individually or just SNF, local dentist, or transportation?
Everybody needs to go through the credentialing process. Certainly it's different if you are not a physical health provider, but even LTSS providers need to be credentialed.
Okay. Where do I find the correct enrollment application other than the incorrect form currently on the website?
You will be sent the correct enrollment form when you have your contract sent to you. So the first step is to submit this contract form number 4.xlsx here on this drop-down menu. Fill that out, send it back in with your W-9. We will submit your contract information, and then you will be given the enrollment form that we are currently using.
All right. Will contracted staff be required to be credentialed in a SNF setting?
If there are requirements related to their education and their licensure, then yes, you will submit that with part of your enrollment packet.
So we're still looking for that form. It is on, anybody who's looking for the handouts, it's on the right-hand side of your screen, and you can click on handouts. There's two handouts. There's the presentation that Melissa made today, a copy of it, as well as the contract form. Is that correct, Melissa?
Mm-hmm.
That's what we
yes,
loaded on.
The contract form is your first step in getting your contract initiated. So click on that, fill it out, send it in with your W-9, and that's all you need to do right now to get your contract.
Okay, I have another question here. Where is Pennsylvania Health and Wellness in the process of developing billing software for nursing home claims because of the different complexities of MA claim submission?
So there have been a couple of different work groups that are working on this, specifically with, it's not just the PA Healthcare Association, it's also Leading Age, and I think another excuse me, organization have work groups working on this issue, but I'm not part of that, so I couldn't tell you, but if it's something that you would like more information on, I can certainly get that for you.
All right. Will personal care homes not currently accepting Medicaid be eligible for this program?
Personal care homes and assisted living are not written into the state language, so they are not eligible. We are certainly working with the Department of Health to see if that can be changed, but it's I'm sure you're aware, it's a complicated issue. So at this point, unless you offer a Medicaid billable service, there wouldn't be a need to sign a contract.
Okay, we've got more questions coming in. When should the Philadelphia area submit contracts? That would be phase.
Yeah, phase 2. So we will have the staff on board for your phase starting in the fall. So I would say if you can wait until September, that would probably be ideal. However, I will give you this caveat to say that, we're outreaching to providers every day, and sometimes there are moments where, we're waiting for information to come in, and if we have your information, we can still process it. So it's not a terrible idea to submit your information now. Just know that it might not come back to you as quickly if we have a huge influx of Southwest providers.
All right, I've got another one for you. What is the process for negotiating the payment rates with Pennsylvania Health and Wellness? So as you mentioned that we receive a contract within 48 hours, but what is the negotiation process for payment rates?
So I mentioned this earlier that, at this point we are behind with our contracting, and so that means we're not going, if we don't get people contracted right now, that means that we're going to have a failure on the go, no-go date, which is sometime in September. If they tell us that we can't go, then this LTSS product doesn't roll out to participants. So we're asking that you sign the contract that we're providing to you initially, and that you wait to negotiate rates at the 6-month mark.
Okay. This looks more like a comment. Personal care and assisted living may be downstream provider if the patient pay amount for MA is decent and the patient level of services is appropriate for PCAL. So it seems more of a comment than a question. Do you have any comments around that, Melissa?
I don't think I do. I mean, my understanding is that, you know, as far as provider groups, these were not provider groups that we were contracting with initially.
Okay. Questions around the handouts and the presentation available offline. Yes, it will be made available on the PHCA website later today. Check tomorrow, I would say, if possible, just in case we have some trouble, you know, with that upload process. But it will be made available on the PHCA website, like I said, later today. They are available on the handout should be available on the right-hand side of your presentation in the pane under handouts. There are 2 of 5. We have the capability of uploading 5 total, and there are 2, the Melissa's presentation and the contract form. So those were, I can see them now, they were uploaded, but they will also be available on our website. Let's see if we have any other questions. I have one here. Is RN required in MCO or not?
I'm sorry, can you repeat that?
Sure. Is I guess an RN, I would imagine a registered nurse required in MCO or not?
I think it depends on the type of facility. So maybe this is a one-to-one question, so I can ask more. I can understand more.
Mm-hmm. And we do have Melissa's contact information, which again I'll send out in a follow-up email to everyone following the presentation with links to the recorded webinar today. So you'll be able to ask Melissa questions afterwards. If you think of something later or along the line, I'm sure she would be happy to answer those at any time.
Mm-hmm. Sure will.
All right, I have a question here. If you are an area, it just lost it here. Hold on a second. Let me find this one. For SNFs, what will be the difference with PA Health Choices, MMA, and your program? When does a patient transition to MLTSS long-term care?
They transition on the go live date. So it's by region. Of course, in the Southwest region, it's January 1, 2018. Southwest is July 1, 2018. And then the rest of the state is January 1, 2019. So before then, the participant will be getting information about the 3 MCOs. They can make their choice about who they want to enroll with. If they don't, then they will be auto-assigned to one of the 3 plans.
Okay. I have some more questions coming in. Your comment about signing contract and then waiting 6 months to negotiate payment rates is something new and has not been mentioned before. We are under the understanding that payment rates would be negotiated up front. Is that a concern? Or I guess that's a concern on your end, yeah.
Yeah, I mean, I certainly understand if you were led to you know, if you had been told before that we were going to be negotiating in the beginning, perhaps that was when we thought that we were going to have materials in a timely manner and that we would be able to accommodate a negotiation period. But at this point, you know, it's not that we won't, it's just that if everybody wants to negotiate, we're never going to have an adequate network and participants will suffer.
Okay. Let's see. It looks like we have more questions. Will this be based on the MA rate established at certain picture date? So maybe this is a two-part here. You indicate the SNF pay rate will be 100% of current Medicaid rate. Will this be based on the MA rate established at a certain picture date? I think that was a two-part question, two-part statement.
that I need to get back to you. I'm not sure if that's you mean like at a certain point in time, does your contract get locked in, and then if the rate changes later, your rate doesn't go up? Is that what the question is related to?
Yeah, that's a good question.
Okay, so I need.
Yeah, we can get in touch with Melissa directly on that.
Yeah.
Here's a question. Will enrollment process take place in the skilled nursing facility?
You mean with participants?
I'm guessing that's the question.
Yeah. So the state is responsible for doing the actual enrollment. MCOs are purposely kind of out of that process. So you can work with the Aging Well organization that is holding the participant workshops throughout the state, and the actual DHS for the enrollment information. MCOs are not responsible for doing that part.
Okay, we'll take a couple more questions here. Who do we send the Excel form to?
You can send it to the network management at pahealthwellness.com, and then from there it will go to the appropriate staff person who's assigned to your record. So network management at pahealthwellness.com. I think I thought there was a separate slide that had that on there. There you go. It's right here.
Great. Thank you, Melissa, for that. Okay, a couple more questions. Is there any chance of current rate of the county goes up when provider have contract with MCO?
I don't think I understand the question.
Yeah, any of the questions, you can also send questions. Any participants can send questions to PHCA, and we can either, if we don't know the answers, we can touch base with Melissa or her team to get the answers for you. So you can, you can get in touch with us here at the association as well.
I put up the slide that has our email addresses on it.
Okay, let's see. I have one here. If you didn't receive the information you needed in a timely manner from the state, wouldn't it be wiser to move to the go? Wouldn't it be wiser to move the go live date back instead of trying to move the negotiation date back? What if we weren't happy with the contract in 6 months?
So, I mean, these are all above my pay grade. We've talked to the state about possibly moving the date, and that conversation has not been productive. The date is what it is, and we got the approval for the materials when we did. Unfortunately, it was quite late. So, for a question like this, you would need to go to leadership at Pennsylvania Health and Wellness. I'm the messenger at this point.
Okay. Let's see here. We probably have a couple more. Let's see what I can find here. Some of these have already been asked. If there's any more questions, like I said, we'll just maybe take one or two more, and then we will, you can always get in touch with PHCA or Melissa directly. I'm sure there's going to be a lot of questions here in the coming weeks and months, and we're obviously working closely together to make it as painless as possible. Is Pennsylvania Health and Wellness going to look to narrow the network in the future, and what metrics or measures are important towards staying in the network?
So I have not heard that there's going to be massive cuts of providers after the fact. You know, our business acumen is not to put facilities out of business. We want to keep the network whole. But with that said, there will be quality measures that certainly need to be met in order to remain a provider within the network. Those will be developed at a later time. You know, we're not ready to unroll that because we certainly need providers to contract with us and, you know, get used to our billing system and get paid before we talk about quality.
Okay. Here's a good question, and this is a great lead-in. This is a great question. Will there be live speakers from the managed care companies at this year's PHCA convention? As a matter of fact, yes, there will be. We have, if we haven't already invited them, we are putting the program together now, and we have a session planned. It's kind of a speed dating session, if you want to call it that, on Tuesday, September 26th. In the afternoon, so you'll want to be there. The companies have been invited, or like I said, will be invited to speak. So we'll have an hour and a half, and all of the plans will have time to speak, and then we'll be rotating between 3 rooms or among 3 rooms. And then they'll also be invited to exhibit and also hopefully spend time, and they're invited to attend our Mountainside Barbecue, which is always a good time. So if you haven't already signed up, now's a great time to get in and sign up for the PHCA convention, which will be held at Seven Springs, September 26th to the 28th. So we are looking forward to having more of those conversations, and again, you know, getting as much information and working as closely with the MCOs as we can, moving, you know, from now on, going forward. All right, I think we'll wrap things up here. Thank you, Melissa, for your time today. We really appreciate it. It was a great session. And don't forget that we're going to be sending out a survey afterwards, and we'd love to have your time. And if you think of any questions, send them on over to us. And like we said, if we can't answer them, we will definitely get them into Melissa's hands, and I'm sure she would be happy, along with her team, to get you the answers. Again, this is an open door of communication, and we want to continue that line of communication with PA Health and Wellness. Have a great day, everyone, and look for the recording and the follow-up email and survey. Thanks again for your time today.
Thanks, everybody.